What if you could immediately assess suspicious-looking skin lesions for the risk of cancer with a handheld, non-invasive device? Introducing DermaSensor, the new standard of skin cancer care.
For the first time ever in the United States, primary care physicians and their patients will be able to receive objective, real-time skin cancer risk results using completely harmless, non-invasive technology.
In our FDA pivotal study with over 1,000 patients, a monitor device result was found to be benign 97% of the time, while an investigate further outcome prompts the primary care physician to consider further evaluation and referral, with a sensitivity of 96% for detecting skin cancer.
So the whole process, first calibration step, make sure there's nothing blocking the fiber optic probe tip, which is where the light is emitted and detected. So, okay, great, calibration's complete. So the whole process now, there's 5 recordings to complete 1 lesion scan. So each recording is assessing about 1 millimeter volumetrically of tissue. And instead of sending that spectral data to a lab or a physician to review, the FDA cleared algorithm does an immediate assessment and provides that point of care test result.